I'm going to be talking on diphtheria. Of recent, there was an outbreak in Abombise and it's spreading like wildfire. And the funny part is that those that are at risk are children. And as mothers, we have to be careful and we have to be like mother hen to be protective against anything that would want to harm our children or any other person around us. So we're going to discuss what is diphtheria. Diphtheria is actually a bacterial infection caused by Corynebacteria. It is an infection that affects your eyes, your nose, the throat, and the skin. What are the symptoms of this diphtheria? We'll have symptoms like red eyes, running nose, fever, neck swelling, difficulty in breathing, and also there's a patch inside the mouth. It's like a whitish discharge inside the throat. When you open the mouth of the infected one, you will see a white patch down the throat. Those are the symptoms you see. Now, this diphtheria is not a new disease. Most of you mothers are aware that during immunization days, they tell you to come for DPT or pentavalent vaccine. When you immunize your child, after the first immunization, which is at the first 2 weeks of life, BCG and the rest, the next time they tell you to come, by 6 weeks, 10 weeks, 14 weeks, you start hearing Penta 1, Penta 2, Penta 3. Now it's known as a pentavalent vaccine because there are different vaccines combined in one. 5 vaccines combined in one. And that diphtheria is part of it. That vaccine is to prevent this infection. But right now, since there's an outbreak, there's every tendency that if you're in contact with somebody that is infected, you would contract this disease. How do you contract this disease? It's through droplets. When you sneeze, those aerosols, those particles carry the bacteria. When an infected person has this bacteria, you rub it on the door handle, you rub it on the chair. For children, you know they play a lot. If they don't wash their hands, they touch their fellow students, they touch their classmates, they touch their friends, and get this bacteria spread all over. So that's how you get infected. From an infected person, it now moves to a non-infected person and the person would start exhibiting these symptoms. Prevention. How do you prevent this? It is simple. Hand washing technique. You all remember your COVID-19. When there was COVID, what did they say? Wash your hands regularly. You try as much as possible to imbibe this in your children. You teach them that even at school, they should have a tap, a sink, and water, running water, and a soap, whether liquid or solid, but most times we want liquid so that there will be less contact. You put your hands, you don't just turn your hand under the running water or soak your hand in the bowl and bring it out. You make sure that you use the second hand to wash it very well so you can wash off this bacteria. Then we also talk about using of face masks. If you have someone that is sneezing around you, please keep a distance because those bacteria, they don't travel too far. Remember, when you sneeze, you actually sneeze out some particles, but they don't go too far. So if you are with somebody that has runny nose or you can't tell if the person is infected or not, what do? You keep your distance from the person and encourage the person to cover their nose and their mouth while coughing or while sneezing. Then make sure that you get disinfectants even in your homes, in your car, everywhere you go. When you get to your children, let them rub disinfectant on their hand because you can't tell the surface they will touch.